Metacarpal phalange. This is the same technique for whether it's the carpals in the fingers or the tarsals in the toes. So the easiest way to do this is to identify and palpate the joint space of the MCP. I also like to distract, so I'll actually grab the thumb or the finger, pull it down and out, and you can actually see and feel the joint space right there. It's very important to stay off the tendon and the blood vessel. So I'll actually have the patient put their thumb up. Go ahead and put your thumb up. There you go, and you'll see the tendon. So we will not be injecting where the tendon is, and we're going to be right there into the joint space. So now, if you have this ultrasound transducer, it's called a hockey stick. This works really well for small joints, fingers, toes, wrists, things like that. And the easiest way to do this is just put it right over the joint line, and you can actually see the yellow arrow is right where the joint is. And when I open and close the thumb, you'll see that open and close on ultrasound as well. Same thing if I distract it open, you'll see it open up right there on ultrasound. All right, so I have it in view. I'm going to go ahead and clean it with alcohol and chlorhexidine. And I know where my landmark is, right there in the center with the yellow arrow. 1, 2, 3 little pinch. Inject next to the tendon without going in it, and you can see I'm injecting right into that joint space.